Welcome to this session on exploring EMDR. I hope everyone can see me, hear me. Wonderful.
Yes, you're good. You're good, Peter. We can see and hear you very clearly.
Good. I always have my neurotic moments when I turn on thinking, can I be heard? Can I be seen? Sometimes my earpods don't connect, and sometimes for some obscure reason my camera decides it doesn't want to connect either. So lovely to see you all. It'd be great, as some of you are already doing, if you could drop some say hello in the chat, and also just let us know where you come from. We've got quite an international audience here today, and I think we've got one or two more people who will potentially be joining us as we go through. First and foremost, let me introduce myself. Some of you I do know already, so bear with us as we introduce ourselves. My name is Peter Mavitt. I am the head of academics for the LSCCH Asia group. I'm also the president of the British Society of Clinical Hypnosis. I'm going to be hosting you on this little exploration that we're doing. I'm also going to introduce to you my two colleagues here who will be discussing EMDR with me. And the first person I want to introduce is Dr. Thamer Majid. Dr. Thamer, say hello. And where in the world are you now? Because you keep jumping all over the place. Last time I heard you were in the Holy Land. Not quite sure where you are now.
I just got back. Thank you, Peter. I'm very well and back in Kuala Lumpur. Hello, everyone. I'm Thema, and I'm a medical doctor based here in KL. I'm also the medical director at LSCCH Asia and also the president of the Malaysian Society of Clinical Hypnosis. So it's a great pleasure to be here, to be with all of you this morning, afternoon, or evening, wherever you are in any part of the world, and looking forward to the next 1 hour of discussing this very important and exciting topic. Back to you.
Thank you. JP, John Paul, do introduce yourself as well.
Hello, everyone. Pleasure to be here. I'm in Wales in the UK, and I am a qualified clinical hypnotherapist, EMDR therapist, quantum consciousness therapist, ego state therapist, and a meditation and breathwork instructor, and a lecturer for the LSCCH. It's an absolute pleasure to be here and to be part of this exploration in all things EMDR. So thank you, and a pleasure to be amongst my colleagues and friends I get to meet. Pleasure to meet you all.
Lovely, thank you. And I'm just because I'm the only one who hasn't said where I come from. Where I'm based in a little village called Hockley in Essex in the UK, in the middle of the countryside. My decision to stress manage my life by moving out of the hustle and bustle of London, and me and my dogs moving into the countryside with fields and forest all around. So I'm very happy with that. And enough of that. Looking forward to seeing and working with you. We've got people from all over, Gold Coast in Australia, Singapore, plenty from KL, Malaysia, the Maldives, Leeds, everywhere, and Wales, and obviously Northern Ireland, wonderful, Cornwall, and Newcastle in Australia, lovely. So, okay, enough of the introductions. You're here to talk a little bit about EMDR. So, I mean, basically, I think, let me just do a little highlighting if I can. I'm just going to spotlight myself and my two colleagues. Okay, hopefully you can all see us, not mixing amongst the mass of videos that are there. So the first thing I'm going to say, one, we do enjoy questions. So please do feel free to ask questions. There are two ways of doing this. One, you can drop your question into the chat box and I will be keeping an eye on the questions there, as will my colleagues. Or if you want to speak to us human to human, then if you use the raise hand reaction at the bottom of your screen, we'll see your hand coming up and then we'll be able to bring you in to ask a question as well. So without further ado, and the first question really here is, we're all talking about EMDR. What is EMDR? Dr. Thamer, what is your perception of EMDR?
Well, for me, EMDR is like a magic tool, basically. It's rapidly treating unprocessed, suppressed memories of adverse experiences, traumas, and so on. So the word here that I would use is rapid. You know, the swiftness in which it brings about suppressed memories that have not been processed by the mind. And these memories are then kept within the unconscious mind, and that along the lifetime brings about various symptoms and different experiences for people. So what EMDR does is that it goes into the unconscious mind, brings up the suppressed memories, helps to process them and reintegrates them into the mind. Now, coming from a medical perspective, this is so important for our community, because sometimes in the course of our experience in the medical line, we come across patients who have symptoms that they themselves do not know where it stems from. You know, conditions where they come to see us many, many times in our medical practice, and the same repetition of the symptoms appear over and over again without knowing what the exact source is. So with EMDR, we are able to rapidly enable us to see where the source comes from, and not only to identify the source, to help the client process this and to bring about a much healthier lifestyle and a healthier well-being for them. So that's my understanding of EMDR, more so from a clinical perspective.
Pete, what about yourself? How do you see EMDR? Oh, you're muted. Pete, you're muted.
Rookie error. Thank you. I echo what Dr. Thamer says. Absolutely. It is very powerful. It is surprisingly rapid. It is a way of working that's very free-flowing. Once you've learned the protocols, then once the process starts, you don't know where it's going to go. And more importantly, nor does the client most of the time. So if they have an idea of where something started, it tends to go further back than that still. So yes, I love using it, and I've only come across like one person that it wasn't right for them, and that was purely because it was too early in their journey. But now I've used it with them later on, and yeah, it really unlocks and helps them process, but then also goes on to doing the healing work of replacing the emotions, the beliefs, the negative beliefs with something far more resourceful and positive that allows them then to just move on. And the most common statement I tend to get when I've used EMDR is, oh yeah, that just doesn't bother me anymore. I know it happened, but I don't feel it. And that is wonderful to thoroughly let you know that has whatever that incident was or incidents were, they've been processed and they no longer affect, and then that branches out into so many different areas of life by being able to let go of whatever it is they've been carrying. So yeah, no, a fantastic technique.
So what I mean, how do you feel? What do we know about what's going on within the mind that proves EMDR is effective, Dr. Thamer?
So how do we know that EMDR is effective in accordance to the symptoms, you mean, Peter?
Yeah, the symptoms and the theories behind what on earth's happening as we process EMDR.
Okay, so basically when we go through any experience in life, good or bad, it forms a memory. So that happens for all of us. Now, with that memory comes beliefs, emotions, perceptions, and that forms our experiences. And most of the time we are able to process those memories. So if a trauma happens, a memory is formed, and the emotions and the beliefs around it over time are processed healthily. They are reintegrated so that when we encounter a similar experience in the future, we are then better equipped to face that situation. We have more skills, we have better strategies to be able to go through those challenges. Now, if there is a particular trauma that happens and a person, for whatever reason, is not able to process it well because of strong defense mechanisms, for example, what happens to that whole experience, that whole memory is, it becomes encapsulated. So the memory and the beliefs that are associated with that memory, the experiences, the emotions, everything becomes encapsulated, it gets suppressed. And then when they go through in life, every small trigger, brings about a huge symptom, a huge array of negative emotions, and they just go berserk. They do not know why things are happening to them. Sometimes it's so suppressed, it's so in the background that you don't even know what the source is. So what EMDR then does is, in a safe environment, what it does in stabilized clients, we bring up that suppressed memory. We bring about that suppressed memory using either auditory, visual, or kinesthetic means, which we will talk about in a short while. So we bring about that suppressed memory, we bring it up. We then help the client to process that memory in a healthy way. And then once that is done, the memory remains beneath those memories, but the emotions that are associated with those memories decrease, diminish, and it becomes easier for them to progress through life and to face similar challenges, but in a healthier manner. So this is very similar to what we do in medicine as well. For example, if there is an abscess on the skin, and if you do not do anything about it, that abscess is going to spread, eventually become a sepsis or gangrene, and you may even lose a limb. So here, EMDR, what it does is that there is a clinical incision that is done, and all the abscess is brought out to the surface, the wound is cleaned, and healing is facilitated very rapidly. So this is an analogy using clinical terms. So that's my take on that.
BP, what about yourself? I mean, how are you viewing what's going on with EMDR and also from your experience with it?
Yeah, well, people come with, everybody's trauma is different to start off with. What one person can just go through life very easily and deal with can be something that really affects somebody else. It's important to recognize that trauma doesn't have to have happened directly to the person. It could be something they've heard, something they've seen, something and that's affected them, and then they've built these negative belief systems around it, which then cause them to react and respond in ways that have negative impacts on them throughout their lives. I do a lot of work with birth trauma, and that is so different from one person to the next. I also work with lots of abuse and neglect issues, but it doesn't have to be anything as big as that. It can be just something that has made this part form in that moment to get them through something, but instead of being able to be processed, it is stuck. So when something else comes, a smell, a sound, a sight, a thought, anything that person will react with this, can react in the same way as if that moment was happening there and then. And by using EMDR, as Dr. Thamer said, we release that. It is, we have a structure when we do EMDR. We have rating scales, which is something that was totally new to me when I was learning it, from my background initially being in hypnotherapy. But it is such a rapid way to really go to places that they don't, the client themselves may not be aware of at all. And again, it is that healing. It is, the whole point of it is, it might sound a bit full on going straight to the trauma, or what they perceive was the worst moment of that trauma. But after that, where it goes, you don't know, the client doesn't know, as the memories just start to free form and link in their own special way, which unblocks that great big tight knot of everything, the stories around it, the beliefs around it, that starts to unfurl bit by bit by bit. I find it really fascinating when somebody just suddenly gets to a point and they go, actually, that wasn't my fault. And it can be going somewhere, or they can be going somewhere from trauma, really bad abuse and things, to going, I'm sat with my dog now. And it's a strange process. Wherever it goes is the right way it needs to go. But it is so rapid. I don't think so far I've not gone past 5 sessions with anybody. And I've had quite a few 1 sessions. So where I've been like, okay, this is really heavy stuff, this could be a lot, and 1 session has just managed to shoot it. It is quite miraculous. It is one where you just have to go with it, just follow the protocols through that you've been taught, and allow what needs to be. But the difference in the person afterwards, it is in a dissociated state, is immediate. They recognize it, and it's lovely catching up with somebody a week later, and they just go, actually, no, I think I'm good now. That doesn't bother me. And my friends have said, my partner said, oh, I'm doing this different, I'm feeling better, I'm acting differently. So it really does, everything that they have believed about themselves around this trauma, whatever it may be, or the negative thoughts or the negative self-beliefs, they're gone, because we deal with those and we teach how to keep relaxed if other things come up. So they've got their own toolkit to use as well. So it's a phenomenal way to work. I can't praise it enough. It's one of my favorite tutors. And it's interchangeable with, yeah, I do a little bit. So yeah, and I loved it when I practiced, when I was training lots as well. So it was a totally new experience for me, to go through a structured program for when you're going through the EMDR process. But no, I'm a definite fan of it. And yeah, I am soon to be starting working with people whose friends and relatives have committed suicide, and it is purely they purely want EMDR. So that's coming through, and things. It can be that, but it doesn't have to be as heavy as that. So because you can use EMDR purely for bringing in positive resources, which is lovely. Obviously, we're taught and we're trained to do the trauma side and the positive things, but you can use it predominantly just for bringing in positive resources, bringing in positive belief systems, and that is wonderful. And the fact you can blend it with other therapeutic styles as well makes it a wonderful tool to have. That's for sure.
But I think that's important for us to remember. It is very much a part of the concept that we have nowadays of integrative psychotherapy, where people are bringing in different approaches to their therapeutic practice. Excuse me, that's not based around one particular theoretical style. Yes, three of us here, we are hypnotherapists to begin with, but by learning different approaches, we bring those in. And I do also, we also need to remember, yes, EMDR was originally developed to treat trauma. Francine Shapiro, sadly no longer with us, when she first discovered EMDR, story goes, she was walking through, she was working at one of the veterans hospitals in America, treating Vietnam War veterans who were highly traumatized. And one day she was going out for a lunch break, mulling something over in her mind, walking through this the park in the campus under these trees, and light coming through the trees was flickering away, and her eyes were moving. And what she noticed is that as her eyes are moving, these thoughts that she was having were being processed out. She was coming to a rapid resolution with regard to these thoughts. And so from that point, she started working, being the good scientist that she was, and clinician, she started thinking, right, how can we use this with my trauma clients? And that's why, EMDR got very much associated with working with trauma and all types of trauma, long-standing trauma, recent trauma, ongoing trauma. There's a bit of a debate in the EMDR world about the concept of, does it work with complex post-traumatic stress disorder, CPTSD? Well, my experience of working with, I think by far the majority of my clients have CPTSD. When I'm working trauma-wise, it works really well with that. But it works with more than that. It works with a whole host of other symptoms. Basically, if there is a symptom that has a psychological basis, then EMDR can work with that. I've used it working with weight management, stubborn smoking cessation, certainly really strong phobias, pain management, emotional pain, physical pain, and psychosomatic pain. There are protocols for all of these in there. And I noticed somebody earlier, and I can't remember who it was, had their hand up, and also left a message in the chat about, can it work with physical illnesses? It doesn't work per se with physical illness. You can't EMDR away something that's physical, but you can work on the emotional reaction to that particular condition. So if you've got a very negative emotional reaction, you can use EMDR to work through that. And okay, let's put on my other area that I'm passionate about, and that's the mind-body connection. We know that negative emotions impact the immune system in a negative way. If it's impacting the immune system in a negative way, it then slows down, hinders, impedes the process of healing. Change the emotion, and it can change the way in which the body beneficially change the way in which the body is healing, but we can never guarantee that. Sorry, I don't know your first name. It just says Binder, but you've got your hand up. So,
hi, Peter.
Hi.
The second time I'm joining your talk, and it's always super interesting. Thank you very much. I have a specific question. A client has a rash around the nose. So I'm if that's okay to describe the
Yeah, please do.
So a rash around the nose. I don't know if you know Rüdiger Dahlke. Rüdiger Dahlke is a German doctor who actually always relates, or who relates any kind of illness to emotions, like we all do in hypnotherapy. But there's always something very interesting he has to say. And in this case, I think, like having something in the face. She's an actress. Having something in the face has to do with this is how the world sees me, or this is like, like a limiting belief maybe, or an excuse for her to show up with this thing in her face to protect her from something. Yeah. So if EMDR, I would normally immediately say, okay, let's try parts therapy or hypnotherapy. But with EMDR, what is the difference if I would use EMDR compared to parts therapy or hypnotherapy? That's what I don't understand, because I think it's very similar to hypnotherapy. It's very similar to parts therapy. Where exactly does it happen Or is it more successful? Is it the same, or where exactly does the change happen? I don't know. Do I make sense?
Yes, you do.
Okay.
Dr. Thamer, what
Okay.
do you feel about that?
Well, it's an interesting question. So a client with a rash on the face, it could be due to a medical condition. Yes, that would be the first thing on my mind. Or it could be a secondary gain kind of a thing where, you know, there is something underlying that's there. Now, with hypnotherapy and parts therapy, we look for the resources that the client can get out of their own mind, the unconscious mind. What is it that they can get to aid them in overcoming whatever issues or problems that they are having? We place new neural pathways as to how they would behave, how they would go about in life, and so on. Now, with EMDR, what it does is that suppressed emotions that may have been present in the past, during childhood and so on, those things get brought up to the surface. Now, this brings about one of the cases that I saw in the past, a client who came to see me having constant headache, chronic headache, and she had gone through various investigations and modules, and even gone through hypnotherapy and so on, and still the headache was there. It goes off for a while after therapy, but then after a couple of months, when there is some form of trigger, which she doesn't even know what it is, it comes back again. So EMDR was done for her. And what happened during EMDR is the first few sessions, it is just, you know, images being brought up to the surface, you know, certain discomfort, there's certain memories from the past, that was about it. But there was once where she suddenly saw herself in her childhood home, where she was left behind by her family. She felt abandoned and she felt alone, she felt scared, and that completely put her in a very frozen kind of a mood. And that happened in her childhood, something that she had completely forgotten, and it just came about. And when she came out of therapy after that, she said that that was a memory that she had forgotten. And, you know, suddenly she felt that that could be the cause of what had been happening in her life, the headaches and everything associated with it. And true enough, after that particular EMDR session, she did not have any more headaches, it's like a miracle. So what I'm trying to say here is that for your client doing hypnotherapy, doing parts therapy, we may be able to bring about new neural pathways as to how to move forward or to get resources. But to go to the core of the issue, to find the source of the trauma, EMDR would be a much better approach, because sometimes we do not know the trauma that we have within our unconscious mind. So this brings about, you know, that magic comes about with using EMDR. Even I have gone through EMDR myself in the initial stages of my practice. You know, there are things that we want to try on. Why do I feel afraid of standing in front of crowds? Or why do I feel afraid of relationships? Or why do I feel... So, you know, we go in for one thing. We go in for, okay, why am I afraid of relationships? But you come out realizing of so many things that have been suppressed. And the best part of it is that within 2 or 3 sessions, all these things get resolved instead of 10 to 12 sessions of going through therapy and so on. So for your client having the rash as an issue, I personally feel that after having stabilized her well, a session or 2 of EMDR would be very beneficial to find out if there is any core reason, or as we call it, a node or a target, something at all that she may have in the past suppressed, and that could be the reason why she's exhibiting those symptoms in the present. So that's my take on that.
JP, what about you?
I understand where you're coming from with okay, I don't see the difference between hypnotherapy and doing parts therapy. With this, it is a totally different technique. So with hypnotherapy, yes, you have an idea and you'll be doing work, be really quite guided in things. Whereas this, it's the second most free-form way of working that I'm aware of, that I practice in at the present. In that, so if you're focusing on the belief around that, or the causality of that, that would be your initial image that you ask them to bring to mind. Then you are asking them to do eye movements. You do a certain amount of eye movements, you get them to close their eyes, okay, to let them rest for a moment and say what comes up next. And literally it is whatever comes up next. And you've got a rating scale as well to gauge things by. And then you do the eye movements again and what comes up now. And literally they go there. Unlike hypnotherapy or parts, we're asking them to see something. We don't do any of that with EMDR. We are just working on what they come up with every time. And what that is that processing that's stuck with the trauma, with the negative belief systems, that is that unfurling bit by bit, which is why I said at the start, wherever they think that something might have started from, if they have an idea, then it normally goes back a lot further than that. I know for myself, I went back to being 3 years old when I thought of something that had happened at 7. No, I went back to 3 and I had no conscious recollection of that memory at all. But that released the symptoms that way. But it is freeform. We literally just do the movements. Every once in a while, we'll check where they are as opposed to where they started on the rating scale of 0 to 10. And we're looking for scales to come down and things. And then we start bringing in the positive beliefs instead. So you get them to a place where they've got to where this started from, whether it's the belief, whether it's the memory, whether it's a mix of emotions, whatever it may be. And the vast majority of people, once the first image is there, which is the toughest one for people to work on and things and to bring to mind, as in normally the most painful, if they have an idea where that came from or they have an idea of where that belief started from, they don't have to. But from there, it is really free form. Their mind just goes, and it goes through such all over the place. That's why it can suddenly be, I'm petting my dog. And then it can be back, I'm with my gran. Then it can be, oh, now I'm this age. And it's only through asking questions, making notes, then you continue that process. But with you've got rating scales to work and gauge things on intermittently, then you know that trauma is starting to unfurl. And it is getting less, and it's letting go of that until they get to a point where they're just okay with it, or they may have a moment of just feeling like, yeah, that doesn't bother me at all. It doesn't affect me. But we're looking for the rating scales to go down. Then we install the positive beliefs and thoughts they would like to have about themselves instead. Yeah, very, very different way of working. It's hard to explain it in a short way. So it is alongside ego state therapy, 2 of my go-tos now constantly for blending in and out with, because if somebody's stuck, as Peter says, with things, particularly CBT as well, then getting somebody unstuck on a negative belief, then you can go back to your initial way of working. But yeah, it is unlike anything else. I use parts therapy a lot, and hypnotherapy obviously, but yeah, this is totally different. When this starts, if a person takes to this, which, as I say, I think one person, but she just wasn't ready at the time, everything was too raw to go to that initial place, did after a few sessions of stabilization, then that's it, things just start to shift rapidly. But we don't give anything, we're not doing any guiding work, we're not asking them to see anything apart from that very initial seeding moment, if they know what that is, or the emotions of where they feel it in their body. So that's this really does encapsulate everything. We're not just working on, okay, so what can you recall? It's okay, where do you feel it in your body? What's that sensation like whenever if you think of that? So it's a totally different way, and you heal all of that as part of the process. So it's not just the memory, it's the feelings, it's the emotions, and it's the physical sensations as well. that we're looking to all heal in one go. I hope that helps.
I think it's interesting with EMDR, you're working with all the different components that bring something together. You've got the somatic experience, you've got the emotional experience, you've got the belief structure. So every element that comes together, we bring it all together in order to strip away layers. It's almost like a psychological drain cleaner. You know, we hypothesize that a lot of the problems that we have come from blocked memory pathways, links within the brain that link up component parts of our mind in order to solve a problem. With EMDR, it's just like, you know, you've got this drain cleaner that cleans out where these blockages are to allow a greater free flow of elements. And, you know, what you were saying with regarding the rash, you've got a good example there, of course, making sure there's no medical reason for it. But you've got a good example that of an outward expression of inner turmoil. We often say the skin is a mirror of our emotions. And it's interesting, as you say, she's an actress. And what is this psychologically doing to her? EMDR can go down through the years and also accesses. I've had people access what they believe were in utero experiences with regards to that. And so it goes very, very deep, and it is very, very free flowing. I mean, during the processing, essentially, all we're doing as therapists is, you know, getting them to follow our fingers as they move, or we've got auditory stimuli, or, you know, we've got tactile stimuli, doing it something like this. The client does tapping on the shoulders, butterfly hug. And all we're doing is literally, we say nothing, you know, as they finish a set of movements, you say, what comes to your mind now? They'll tell us, and all we say is stay with that, whatever it might be. It might be I'm skipping gently through a field of daisies, or I've got this horrible thing happening to me. This is all part of the memory clearing out. You can go round and round and round and round and clear a lot of rubbish out using that. So hopefully that kind of tells you. We've got Kiara, who has asked a question about how do you incorporate it into your hypnotherapy sessions? Do you just EMDR specifically within your sessions when the client would benefit from it? A lot of EMDR, it's what's the link between EMDR and hypnotherapy? EMDR purists say nothing. Those people who have experienced EMDR and are hypnotherapists recognize the trance state. You know, what do we use? The pendulum, or the LSCCH-UK group teaches an induction, rhythmic eye movement induction. It triggers a form of trance there. I would argue, and that's a debate for another day. What we're looking at here when we're integrating it is, I will always start with hypnotherapy, or, you know, it's not just hypnotherapy, it integrates with all psychotherapies. I'd start off with my prime modality, which would be hypnotherapy, to stabilize my client, to do some work and some change work in the here and now, prior to accessing or going into the psychodynamic stuff, where we're looking at connecting with the deeper issues that are down there. Once I've worked with that using EMDR, we're also ego state therapists as well, using ego state therapy, or, you know, you might be a CBT professional, or any other form of EFT professional. You go back into then building on the stuff that's come out of the EMDR, building on the result of EMDR. So it kind of is sandwiched in the middle of it all. Also, you can find, I often find that if I'm working hypnotically and there's a particularly tough blockage that's come up, some reason they're not regressing, they bounce off it all the time, then I might consider using EMDR to work through that particular blockage. I know CBT therapists, when they hit very entrenched negative dysfunctional belief, will use EMDR to process through that particular belief before going back into their standard approaches.
Sorry.
Nope.
So sorry, can I just butt in? So that means that in your session, in your hypnotherapy session, or wherever you are, when you reach a point where you say, wow, that's now super interesting, or there is a blockage which the client tries to avoid, to push through for whatever reason, you just start with the EMD. But like, for example, with me, when people are in hypnosis, they have their eyes closed. So you just say, okay, now I bring you back 1, 2, 3, 4, 5, and then you start the EMDR, or what?
Only with informed consent. Because of the psychodynamic nature of EMDR, you need informed consent to use it. So if I've got a blockage and I haven't got informed consent at that point, I won't use it. I'll guide the client out of trance. We might have a discussion, and then if they've agreed to it, then we engage in EMDR. So just very aware of timing here. I know I've got quite a few questions. So Andrew asked, does it work with children? Yes. It's quite a specialized area within EMDR, but like with a lot of therapies, it does. If I'm working face to face with a child, I get them to draw a little face on my fingers. So builds rapport, and then they follow the face as I move left to right. But it does. Obviously, if it's child with trauma, that's very specialist work, and you've got to be very, trained to deal with that. Marianne says, once the memory is brought to the surface, is there a technique used to process the memory in a healthy way? That's what the EMDR does, because the memory accesses the memory, brings it up. It then works through the emotion attached to the memory, the negative beliefs attached to the memory. We can then install positive, more acceptable beliefs using EMDR. And then I move into hypnotherapy or another form of therapy to reinforce what's come out through EMDR. So it works very, very well that way. Just going through these now. Given that there are several methods of altering the emotions attached to a particular event, what is it specifically that the eye movement is doing neurologically that makes this different to, say, tapping or revivifying in trance? Or neurologically, what it's doing is it's stimulating the oculomotor nerves. The oculomotor nerves, basically, if we are traumatized, we go into fight-flight response. The amygdala starts to fire up, apart from our fear and our anxiety and our aggression. Oculomotor nerves, when we are feeling anxious, we see people looking around a lot like this. So neurologically, what we're thinking is that using the eye movements, or to be perfectly frank, it's the bilateral stimulation, the left-right stimulation that seems to be happening. It seems to connect through the amygdala and process out the fear element of it, but also with the left-right, the bilateral stimulation, neurologically, you are balancing out the left brain logic and the right brain creativity, so to speak. So in effect, the hemispheres of the brain become perfectly balanced, and scanning studies have shown that effective problem resolution, you do see an appropriate balance between the two. Trauma, too much emotion might be attached, or too much logic might be given to that. And I'm not saying that EFT and other techniques don't don't have their own routes through. EMDR is another route. It is a very effective route. Other approaches are also effective. I like this particular route because of its association with hypnotherapy, and also the fact that there's a lot of the World Health Organizations, World Health Organization really supports it as well. Another one here, would EMDR be helpful if the client has difficulty in retaining attention and a short attention span? If yes, how would you administer that? Well, it would be if there was anxiety and fear. So if you've got somebody who is anxious and not retaining information because of the anxiety, or has a belief that they can't, I can't remember anything. How often do we say that? So we would potentially challenge that that belief. JP, what's your feeling about that, about attention span?
And that's an individual gauge that you'd have to get as the therapist in your own right, because that is quite a broad thing, obviously. But they're not the person, the client that isn't actually paying attention. You are letting them drift freely in their own mind. All they're doing on the very basic level is following your fingers. That's what they need to do, and that allows the process. Where their mind goes then is totally unknown to them and unknown to us. So that it's not like having to focus on words. It's not like having to focus on a conversation, because that isn't happening. Apart from that, not knowing the client that you have in mind and things, I really couldn't say any further. But it's not a case of, oh, you have to focus on this. And once you've worked on the first issue, you've got the seeding event, the seeding feeling or belief. That's the only time that they focus on that. After that, it is just where their mind takes them. And so it's a different way of focusing. It just happens automatically. While they're moving the eye movements, I know this from my own time of training and practicing and having EMDR done about 7-8 years ago. It's literally in that pause after where you close your eyes and you're just left to just be quiet for a moment, then ask, okay, what comes up? And whatever thought, whatever image, whatever feeling comes up, that is where you go with next. So it's not an intense focus thing in that way, but it is a lot of work going on internally.
Dr. Thamer, what about yourself?
I agree with
keep helping someone with attention.
Yeah, I agree with JP. Basically, the attention only comes when you tell them to, focus on the fingers, and eventually the unconscious mind takes over. So it's given free rein to just access every single part of the mind to see, what is it that has caused the issues to come about, the symptoms to come about. And then that's why when you tell the client, okay, bring about that, the traumatic event or the memory of it to mind, and then look at my fingers and just follow my fingers. Initially, they would be thinking of that image, whatever that had been there in the mind, but eventually the mind does drift. And then it goes to that part, that link, that second link that would bring them closer to the root cause. So that's what it means. There's no specific focus as to one particular metaphor or an image and so on, as in other modalities. So yeah, it's a free flow.
Lovely, thank you. Going to say, just keeping an eye on the timing. Got a few more questions here, and then I'll talk a little bit about our course. Very good question from Pam. Is there any danger in using EMDR if one has no mental health training? Yes. You've got to know what to do with that, which is why when we train with EMDR, we will only train people who are trained in some form of mental health practice. You need to understand the mind before even delving anywhere near the traumatized mind. So, so that's an important part there. Is the client in trance when integrating EMDR? Yes, I would always say they do recommend prior, hypnotherapists here, prior to going into using EMDR, you should relax your client. What is hypnosis? State of deep relaxation and focus at one level. So yes, we teach it that hypnotherapists can use a very light trance to go in. Non-hypnotherapists can use a light relaxation process, hypnosis, as they go to guide their clients in. So that's there. Does it work better face-to-face, or can it be done online by Zoom? It works brilliantly both ways. I am essentially now basically based in the rooms I'm in online. I've got quite an international client base, and I use EMDR all the time online. As I do with hypnotherapy, I find it equally as effective face-to-face as it is online. And there are studies that show that all forms of psychotherapy are as effective online as it is face-to-face. In fact, a lot of healthcare organizations around the world are moving their practices a lot online with that. What is the difference between EMDR and IEMT? I think there's protocol differences, and I'm trying to remember. Sonia Richards, I know, who does IEMT. I think it's protocol and theory based. That's what the difference is. JP.
Yeah. Can I just say, just quickly, what you said earlier about with hypnotherapy, is you are taught a safe space to use for anybody, so you don't just go straight in and go, okay, we're going to do EMDR and things. We build it up the week before and things. You get that set in place with your clients, so you understand what EMDR is. Install a safe place to go to, which is something they can use all the time, but it's important to have that within EMDR, because things can get really quite emotive. You have a lot of bad reactions. And if you feel they need a break, you've already explained to them that you can just ask them to go, just take a break and just go to your safe space, have a few breaths. And on the other hand, if they feel things are getting too much, they can raise a hand and you will know, okay, where they are now is that's it. Go to safe space, allow them to do that, then just bring them back out, okay, and go, okay, when you're ready, we'll continue where we left off and go from there. And that tends to be great if that happens, which doesn't happen that often that that's been needed, but when it has, it's been an absolute breakthrough moment where they've disclosed something that they've never, ever spoken of before, normally wrapped up with a lot of shame and guilt and things, in my experience. But yeah, so we do use that element, and yes, we could say that's a straight in the therapeutic approach, but yeah, it works really well, and it's a nice safety buffer for both yourself as a therapist, of recognizing what's coming through, and for your client that they know that. And sometimes knowing that they can just put a pause button on things if needed is enough for them never to need it. Yeah.
And got a question here. Do we get a demonstration today? No, a demonstration would take about an hour or more. An EMDR, I can't just do sort of, it's an hour or more of doing that. On the course that we do, we demonstrate it, we get you to practice it on each other, so you get experiences on doing that. Fran, your question there. What I would suggest is connect with Riska, and you and I can have a chat about the your skills as to whether you would be able to learn EMDR with what you're saying. What level of mental health training is enough? Does one have to have counselling experience? No, hypnotherapy is certainly enough. hypnotherapy, experience of hypnotherapy, being trained in hypnotherapy, or being trained in counseling, or being trained in ACT, or being trained in whatever your discipline is, will be enough to then start to integrate. We teach it from a very safe perspective. The course that we teach is a course that I basically wrote, well, oh gosh, 1999 time. It was a part of the old college, the old original LSCCH. We were running a master's degree program with the University of West London, and it was the course that we teach, improved it since then, was part of that master's program that we were teaching there. It is can it be done on the first session? No. I really wouldn't recommend doing EMDR on the first session, because it really does need stabilization prior to doing it. You don't know what's going to come up, and we've got to ensure the client is psychologically stable enough in order to be able to then go through the process. And there are ways of using EMDR as a stabilization tool as well, which we do teach. And it is very client-based. Andrew, perfect. It is very client-based. You go with the client. It's very very much we follow the client. We never force the client in any particular direction. One person's got their hand up, as long as it's very quick, because I've got a PowerPoint that I need to show you guys.
All right, just a very quick question, because you know, the movement obviously connects both sides of the brain, whether we walk or whether we do that movement with the eyes, and that's specific now to hypnotherapy. Would it not make sense, before you bring somebody down in hypnotherapy, to just do like 5 minutes of eye movement? I've never thought about it, but just do the eye movement and then start a normal session.
Think of the classic induction. We teach an induction as part of our diploma course called the Rhythmic Eye Movement Induction, which is deliberately based on basic movements of EMDR.
Okay. I use rolling. Yeah, okay,
let's go back to the swinging pendulum of old. They use that, you know, rhythmic eye movements, left, right eye movements are calming anyway, neurologically. So if any of you are anxious and want to reduce your anxiety, you know, do some deep, proper breathing. I refer you to JP, but also do some just horizontal eye movements with that. Okay, I'm going to just quickly present a little PowerPoint now just about the course as to what we do within that course. So bear with me whilst I bring the share up. Okay. Boom. Okay, our course, just so you know what we do, it's open to all qualified therapists from all psychotherapists. So just remember that we do want qualified therapists. You've got to have an understanding of how the mind works and working with the mind. We teach you how to be safe with EMDR. And that means you don't need to be a hypnotherapist to do this. So what we teach on the course, we've got a freebie within the course. We've got a free module that we've added in on solution-focused therapy for people who are interested in that. A lot of EMDR is based on the problem, and going through EMDR does produce a solution. But it also is good to have a set of techniques that you can do. You can work with a client looking at some very positive solution-based ways of working. So it's part of our online delivery for that. We will teach about understanding trauma. Trauma is a complex condition, and so we will help people to understand about what working with or what trauma is. we teach the basic protocol, but we teach a variety of EMDR protocols. It's not just the one protocol. There are various protocols for different types of trauma, different types of phobia, different, working with pain management, with panic attacks, weight management, addictions, and so on. So we will talk about those or teach those in the course. We have 4 live weekends within the course, which is very heavily practice laden. And of course, we do demonstrate the technique as the best way to see. We also have within this 2 midweek 1-hour live lectures. One is about the theory of EMDR, and one is the understanding trauma elements that then we build up on as we teach. We do record all our live therapies, our live training sessions, so that people can revisit them afterwards. You get access. You can't download the videos, by the way, but you get access to the videos after we've taught a weekend. And, as you've seen today, we like to discuss cases. So we do have this opportunity to discuss cases there. We have our own learning zone, the LSCCH learning zone, which is our online education portal. And in that, we've got notes, we've got a variety of videos and all sorts of elements within there, including some quizzes. And the exam for this is very simple. You've got continuous practical assessment as we observe you during the course, and also at the very end there's an online MCQ that we ask people to complete, or you need to complete in order to qualify with this, looking at, and it's basically around theoretical concepts with EMDR. And it is a live virtual course, hence we have a very international element, and that's wonderful because it gives us the opportunity to, on the courses, discuss different cultural perspectives with regard to that. So, and because not everybody works live, works virtually, we do talk about how you do this face-to-face as well. So you get skills in both of these elements as well. And once you've qualified, there is, of course, an opportunity to join our therapy centre, the LSCCH Therapy Centre, which we're growing and evolving as we speak. So just, so you've got that information that's there. We do have a course starting very shortly, 8th of June, but the first teaching weekend is something like at the end of June, so you've got time to book up on for this course if you want to. Riska is the person very much to talk to about the course itself, and she'll be very happy to talk to people. Before we go, I'll get her to say hello as a person, so you know who that is.
Hi, Peter. Can I just tell everybody to check their spam as well as the inbox for an email from me, because often enough it goes to junk mail just because of the size of the file that's being sent. So if you're interested, please check your spam, junk email just in the next couple of days. Thanks. I will be in contact. Hi, everybody, and thank you for joining.
Lovely, thank you. And as I say, look, I mean, I found that EMDR has enhanced my practice no end. It gave me an opportunity to work with symptoms that I hadn't previously felt I was capable of working with. I also had the opportunity to work with symptoms that my standard approaches were being as just blockages there. So it gave me a very different way of exploring those. So that's all I've really got to say about that. Dr. Thamer, any final concluding remarks?
Well, what I can say is that EMDR is the most important tool that I have learned. I've learned many modalities, psychotherapy, but EMDR is pure magic. So anytime there is this particular symptom of a particular situation that I find difficult to overcome in a client or even myself, EMDR is the way to go. It's fast, it's safe, and it really does work. So it's an amazing tool to have with you in this journey of helping clients along the way.
Peter, can I add just one other thing? Because this question comes up constantly. And I see it's come up again with Katie. EMDR, I think you can actually, the qualification for the I think you can deal with that one, but insurance, we have insurance that covers you in the UK as well as in Australia, and we can point you in that direction. Peter, you want to do the EMDR therapist qualification?
Yeah, the qualification itself is accredited by the National Council of Integrative Psychotherapists, who are just about to be raised to the level of the CNHC. PSA is just about to validate them, so the Public Standards Authority in the UK. But yeah, the qualification, we have a lot of people who are practicing, well, everyone who trains with this practices, we've been training since, as I say, 1999, when I developed the course that we're doing. And so, yes, you will be able to practice. Depends, so, there is a lot of politics, as we all know, within therapy, and certainly you will see the politics. It does my head in within the EMDR world. There are certain areas that say thou shalt not touch this unless thou art a doctor of the highest order. And you know what? People don't get sued for malpractice. Properly trained people don't get sued. There are many, many people out there who are practicing who aren't doctors. It is safe. So say 20 plus years we've been training, 20 plus years we've had people out there practicing. So it is good. It's enhancing people's practice. We're bringing it in. We're using it. Our qualified practitioners are using it within charities around the world, all over. So we teach a very comprehensive approach. And yes, I am looking at evolving the course and doing a part 2 as we speak. Not going to happen just yet, but it will be a part 2. JP, your final comments.
Yeah, well, after qualifying as a clinical hypnotherapist 24 years ago, this was the first thing that I tackled since, and it has broadened the work that I do massively. Things that used to take a lot longer certainly don't with EMDR. It is very safe to use once you learn the protocols, and it is a set format, although it's very free-flowing inside that format, but you have your guardrails there and things. It was very different for me to use, and quite a test to get out of my comfort zone when I was training. But as with anything with the LSCCH, then you get lots of practice, which is fantastic. And that for me, you can't learn these things without experiencing them. And so after your weekends of having several times of practicing each weekend, once you've got the basics down and things, you'll feel comfortable with it. And that practice of knowing what it feels like, knowing where your own head goes to and things, of just giving over to it and allowing that to happen and work on your real issues, because you can't fake these things, is really important part of the learning process for me. And I think the LSCCH does that better than anywhere else.
I was just waving at somebody else waving at me. Forgot. Okay, thank you, everyone. I know a couple of you joined late, and I'm asking, will you get access to a recording? Riska will be able to send that out to you. Riska is there very much to as a contact, and if anyone wants to talk directly to myself or to JP or to Dr. Thema, Riska will be able to be the intermediary for us as well. So look, I'm going to stop talking now. As you can probably guess, the three of us could talk for another 10 hours on this subject. I would love to talk for another 10 hours. Well, actually, if you come on our course, you can hear us talk for hours. Thank you all very much for joining us and for allowing us to share our passion for one of the many therapies that we practice. We look forward very much to either seeing you again on the course or look forward to seeing you on one of our other free trainings. Do keep in contact with us, because we have plenty of these free trainings, we're starting to bring some masterclasses in paid for, but where we're going to do some intense trainings too. So lovely to meet you all again, some of you for the first time. And JP, Dr. Thema, thank you once again for joining me in this sharing, and we'll see you all again very, very soon. Goodbye, everybody.
Thank you. Peace and blessings.
Thank you, Peter. Thank you.